Hi there, how are you? I'm Dr. Halim, and today I will show you how to examine the cardiovascular system. So before examining the cardiovascular system, let's talk about the patient. I've already introduced myself and taken the consent and asked him for exposure. Okay. Now that we have to examine the patient, first we start with inspection. So the most important things that we can see in inspection is first we have to see if there is any visible pulsation of the apex or visible epigastric pulsation, or if there is a scar of median sternotomy, or if there is any pacemaker. Okay, so those are the most important things. You can also look for some skin problems, but that are not very important. Next, we'll proceed with palpation. And the first thing that we do with palpation, we'll locate the apex beat. Okay, so for location of apex beat, we put our hands. Okay, then suppose we found it here. Okay, so then we found the sternal angle, and then we'll move from the second, and then third, and then fourth, and then fifth. So it is in the fifth intercostal space. Just lateral to the midclavicular line. Sometimes we can actually measure. So suppose I have a measuring tape here. So measure how many centimeters it is. So suppose I have it here, this point. Okay, so this is the midline, and this is about 9 centimeters from the midline. Okay, so this is the first part of the palpation. Next, we have to actually assess the character of the apex beat. Okay. Next, we have to see for thrills, and for seeing thrills, we have to put our hands, especially left hand, especially left thumb, on the catheter. And then look for any thrill in the apical region, thrill in the tricuspid region, pulmonary region, and then aortic region. We are looking for systolic or diastolic thrills. Okay. Next, there are three other parts of palpation, and those are that will look for epigastric pulsation, and then we can look for left parasternal heave, which can be done in this way or this way. Our hands will lift if there is right ventricular hypertrophy, and then we can see palpable P2 in the second intercostal space in the pulmonary area. So those are the most important parts of palpation. And above palpation, the very important thing is auscultation. So we have to start auscultation, and always you have to start with two hands, not just stethoscope. This hand is also very important. So we are going this way. So stethoscope here, and this finger here. Okay, very important. Don't miss it. So first we see first and second heart sound. Then we'll look for any added sound. Is there any murmur or not? Okay. Suppose we have a systolic murmur or pansystolic murmur here. So if we have a pansystolic murmur, we have to look for radiation to the axilla. If we found the radiation, we are sure that it is a murmur of mitral regurgitation. Suppose we don't have a murmur here. So now, sometimes some patients can have mitral stenosis, and the murmur may be absent in normal location or normal position. So that's why we may have to accentuate the murmur and make it better heard. So to do that, we have to actually give the patient some instructions. Okay. এখন আপনি যেটা করবেন, আপনি তো প্রথমে বাম দিকে কাঁথান, একটু অল্প একটু কাঁথান। ওকে, ভেরি গুড। আপনি লম্বা করে প্রথমে শ্বাস নেবেন। ওকে, তারপর শ্বাস নিয়ে শ্বাসটা আবার ছাড়বেন, ছাড়ার পরে দমটা বন্ধ করে রাখবেন। বুঝতে পারছেন? আমি যখন বলবো তখন আপনি এই জিনিসটা শুরু করবেন। And we have to see that mitral stenosis murmur with the bell of the stethoscope. Okay, so we have to see it in the apical or mitral region. Okay, আপনি লম্বা করে শ্বাস নেন, শ্বাস ছাড়েন, এখন পুরা ছেড়ে দেন, পুরা ছেড়ে দিয়ে বন্ধ করে রাখেন। Very good. Okay, so the murmur of mitral stenosis will be a low-pitched, localized, rough rumbling mid-diastolic murmur often with a opening snap and with presystolic accentuation. Next, we'll look for murmurs in other areas, which is the tricuspid area, and the pulmonic area, and the aortic area. And if we found a murmur in aortic area, we also have to look for radiation to the neck. Okay, I think that's the most basic part of precordium examination. Thanks for watching the video and stay tuned for more. Thank you. আপনাকে ধন্যবাদ. Bye.